There are 11 examples of penicillin drugs, and these are: number 1, Penicillin G; 2, Penicillin V; 3, Methicillin; 4, Oxacillin; 5, Cloxacillin; 6, Dicloxacillin; 7, Nafcillin; 8, Aminopenicillins; 9, Antipseudomonal penicillins; 10, Procaine Penicillin G; and number 11, Benzathine Penicillin G. This drug class or drugs will be compared based on spectrum, resistant to penicillinase, and indications. Penicillin G and V are narrow-spectrum drugs, no resistant to penicillinase, and the indications are oral infections and many infections caused by sensitive bacteria. Penicillinase is a type of beta-lactamase formed by bacteria that renders them resistant to many penicillins. Penicillin G and V are very similar, except that penicillin V is more acid stable and has a higher bioavailability when given orally. Penicillin V is often used to treat oral infections caused by a wide variety of sensitive oral bacteria. Organisms susceptible to penicillin G and V are: number 1, viridans streptococci; number 2, Streptococcus pyogenes; number 3, Streptococcus pneumonia; number 4, Neisseria gonorrhea; number 5, Neisseria meningitis; number 6, oral bacteroides; number 7, oral fusobacterium; number 8, Leptotrichia bacchalis; number 9, Treponema pallidum, or what we call as syphilis; and number 10, Actinomyces israeli. Methicillin, oxacillin, cloxacillin, dicloxacillin, and nafcillin are narrow-spectrum drugs. It is resistant to penicillinase, and the indication is Staphylococcus aureus infection. Aminopenicillins like ampicillin, amoxicillin, vacampicillin are extended-spectrum drugs. This includes many gram-negative rats, no resistant to penicillinase, and the indications are mixed infections, infection owing to gram-negative rats. People who have mononucleosis or those who are taking allopurinol will be experiencing rashes. Antipseudomonal penicillins like ticarcillin and piperacillin are extended spectrum drugs. No resistant to penicillinase, and the indications are effective against Pseudomonas, Enterobacter, and indole positive proteus. Procaine penicillin G combined with benzathine penicillin is a narrow spectrum drug. No resistant to penicillinase, and the indication is intramuscular injection to achieve a more sustained effect of penicillin. And benzathine penicillin G is a narrow spectrum drug, no resistant to penicillinase, and the indications are long-term and low-level penicillin effect. Cephalosporins are broad-spectrum drugs. About 10% cross-allergenicity with penicillins. The risk is greater with patients who have a history of acute or immediate type of allergies. Characteristics of 5 generations of cephalosporins are as follows. Cefazolin, cephalexin, and cefadroxil are examples of first generation of cephalosporin, and the sensitive organisms are: number 1, Escherichia coli, or what we call as E. coli. Number 2, Staphylococcus aureus. And number 3, various streptococci. Cefoxitin and cefaclor are examples of second generation of cephalosporins, and the sensitive organisms are: number 1, oral bacteroids, and number 2, Haemophilus influenza. Cefotaxime and ceftazidime are examples of third generation of cephalosporins. The sensitive organisms of cefotaxime are: number 1, Neisseria gonorrhea. Number 2, Neisseria meningitis. Number 3, E. coli. And number 4, Haemophilus influenza. For ceftazidime drug, the sensitive organisms is Pseudomonas aeruginosa. Cefapim is an example of the 4th generation of cephalosporins, and the sensitive organism is Pseudomonas aeruginosa. Ceftaroline is an example of the 5th generation of cephalosporins, and the sensitive organisms are: number 1, multi-drug resistant Staphylococcus aureus. Number 2, Staphylococcus pneumonia. And number 3, Haemophilus influenza.